Brain Fresh audience. We have a special guest this week. We have Dr. Nicola DePaul. Welcome.
Thank you. Delighted to be here.
We're excited to have you. So Dr. DePaul is a psychologist and she's doing big things to help healthcare. So we are going to get all into it. But first, tell us something about you. Tell us some background or a little story, whatever you like to share.
Oh, well, thank you so much, Mary, for having me. I just have to say that. Well, let's see. I am a mom, and I'm kind of a walk-loving, sunshine-loving, coffee-loving kind of a person.
There you go.
And I love making connections. So I guess that's just sort of a general thing about me, but plays well with my role as a psychologist for sure. And I would say I'm also a pretty curious person. So I tend to be somebody who's, really interested in learning about the people around me. So that's just a little bit about me.
I love that. Well, we both have, I think we share the mission, and this is who I invite to Brain Fresh people. We have a shared mission because I feel like the more we kind of join arms, then we can, change the status quo in healthcare and many industries. So I was preparing a talk the other day and I was looking at the literature in regards to burnout, and it was saying very clearly the service industries are the industries where it's a very high rate of burnout. So healthcare, teachers, et cetera, like all the service industries especially where you have like deep emotional connections with other people. And with your background, would you agree with that? That's what this manuscript suggested. Those are the people at highest risk if you're in a profession like that. What do you think about that statement?
Yeah, I think that's true. There's also interesting research out there that shows that people who are early career are at the highest risk of burnout. And then there are some additional factors like being female, unfortunately, puts you at higher risk, and having caregiving responsibilities. So I think it's complicated, but yeah, I would generally agree that people in service industry of some kind are at higher risk. But I think that there's some nuance there. And when people are maybe less boundaried or less secure in their career, less established, there are probably just factors or maybe ways of interacting that raise their risk even higher.
Interesting. Tell us more about that.
Yeah. So from my personal experience, but I think this is supported in the literature, as an early career psychologist, as a psychologist trainee, you don't necessarily know how to have a boundary between what you can control and what you can't. And I think oftentimes our early career folks are also working with really challenging cases and may have a beautiful amount of supervision, but the learning curve is so high that, figuring out, well, where do I fit? What can I let go of? And what can I just let myself not be responsible for? I think is really tough. And then as you go, continue your career or get more experience, it becomes easier to just say, yeah, I can't do anything about that. So I'm still a practicing psychologist, had a patient who is a really challenging, I think some of us would call it like a heart sink patient, just somebody who is on your schedule, like, oh no. And really, this guy is really suffering. But he also wants something really specific. So I met with him last week. He did not get what he wanted. It got all complicated. He ended up in the emergency department. The whole situation just blew up. And, for me now, it's like, yeah, bad outcome, not what I wanted, but, that happens. And it didn't have the emotional toll. And it's not that I don't care, but I think for me, I just have a resilience, or I can have that boundary that when I was early career, I think I would have taken that home and stewed on it over the weekend. And that impacts you and then impacts your off time.
100%. Yeah. I was hearing recently that if we're striving for perfection, it's just unattainable, right? But in medicine and healthcare and psychology, we are dealing with human lives. And so we want to the best quality, the highest quality outcomes we can and give everything we can. But then there's also this, we can't be perfect. And I was just with a doctor in training, and he happens to be, 58. So he's a late career and he's still in training. And he said to me, you're trying to be perfect. You're trying to be perfect. And he was like, I can't. It's so, I'm trying to be perfect, and I can't really come down from his call schedule and thing, because he's like rethinking everything, exactly what you're saying. So when you're new to the area and new to the profession, you think, okay, what's mine? What's yours? What's the profession? What's just chance? And it's so hard at the beginning, and so that's where I think a good mentor or a good team lead can really help the younger team members, the younger residents, or whoever's in training, to just bring some reality check to there, or a safe place to discuss it. Maybe you could talk about that. Like, what can a team lead, like, let's say a good program director or, a healthy program director, how could they kind of open the floor in a safe way for people to share? And so also that they can really talk about, where are the boundaries? Where does that patient end? Where do I begin? Where does my resident life end and begin? And when can I just go have fun and turn it all off? Where are those? Are there boundaries? How do you get them?
Yeah. Oh, I'm so glad you brought that up, because the other piece that I hadn't spoken to is the systemic stuff. And I think those relationships with team leads and with mentors are really protective. And I think if you're a team lead, this is going to sound overly simplified, but I think it's really what you should be thinking about. And it's simple. It's just, can I create space where my people feel comfortable talking about what's going on and talking about imperfections and their failures and what they're not sure about, and making that be okay. So I think another way to say that would be psychological safety, or just having that space or safety within relationships within the team. And when that's present, that's really a pretty significant buffer against burnout. I think that goes for people across the spectrum of their career. But if you're really thinking about residents or people in training, people who are learning, having safety to make mistakes and have it be okay to not be okay, I think is really, really critical. So that's the first thing I would encourage them to do. And you might just ask simple questions. And it could be, how are you doing? Or what was hard for you? You might also want to think about, how can I model for my trainees or my team? And, this is something that I tend to do with my own supervisees and trainees. I have them observe me. I have them point out what I didn't do right, because there's always something I did wrong or forgot, or, that's just life. And then I have them, see a patient, and then we'll talk about how they did and what went well and what didn't. But I think when you can model that willingness to not be perfect, it also is creating safety and connection and community, which is really preventive for burnout.
Yeah, that's so important. And I know what I would hear from a lot of team leads, like, I don't have the time. I don't have time. I have this resident doing this kind of this, and this one not hitting their curriculum, and this one doing this. And so how do you, are there quick little tips, like you said, modeling? And I know the neuroscience of teams tells us, that we have to feel that safety between us, and in order for us to belong. And, we all talk about, everyone wants to talk about like caveman time and lion and tigers and things, but I like to talk about today, so like with today, as on a team, on a busy healthcare team, I want to know that everyone on that team is doing their best, even if they're brand new. We have rotators from all around the world come with us, and it's so amazing. I just met someone from Brazil. He was dealing with cold weather for the first time in his life, and so we were teaching him about winter shoes and, winter clothes. And it's fun to bring new people into the team and to show them that we care about you. Like, I'm not going to know him long. Like a lot of folks rotate through pretty quickly, but we can make a bond, and I can tell them, like, you matter to me. We can have a little fun, but we can be serious about what really needs to be serious. But I think I hear from a lot of team leads, like, I don't have the time. I don't know where to start, because this just seems overwhelming. You just gave a few examples, how did your day go? And probably pause and listen, right? Like, how did that go for you? Or after this procedure, we're all going to go sit, give them some warning. Cause I do hear like the introverts want warning if you're going to talk to them or want them to speak. I'm kind of like mid intro extra, I guess people tell me, so I don't mind speaking up in a lot of situations, but not every situation. So yeah, how else can we support the team leads out there that are really busy, I guess is what I would ask.
Yeah, I have a few thoughts about that. I think in part, it really depends on your context. So I'm a primary care psychologist, so that's my milieu. We have more time than you might have as a hospitalist or in a different specialty.
Okay.
But the research shows that in work, I think this is Marcus Buckingham. I can't remember his co-author. I think it's Ashley Goodall, actually. 9 Lies About Love and Work. So there's some, and they didn't do the research, so my apologies, but they talked about it. So if a team leader spends about 10 minutes a week with each team member, that's actually sufficient. So 10 minutes in a lot of areas or specialties is doable. And if you're managing more people than you can spend 10 minutes with in the week, you're probably managing too many people. Or you need to really think about what are my values and how are my values lining up with how I'm spending my time. So are there things that I can cut to really prioritize that time with my team? So that's one thing that I would say. A different example, I just finished Amy Edmondson's book, The Fearless Organization on Psychological Safety. Fantastic. I highly recommend it. But she gave several examples of people or teams who established very high levels of psychological safety in like moments. So like flight crews, they don't actually have a lot of time. This might be the first time that they're meeting each other and they might be hit with a crisis. So she gave the example of the Sully-Sullenberger flight. There was a near disaster with that airplane. And so the pilot and the co-pilot had been able to establish rapport built on mutual respect and the ability to kind of lower the hierarchy between them and have, the ability to make a connection. And so I think in medicine, we might need to take that kind of approach, especially in, certain circumstances where you don't have the luxury of being with your team or your trainees over a long period of time. Maybe you're meeting with them and then you're doing something risky with a patient immediately. So I think you can establish that kind of rapport that's really healthy and safe for the different members of the team in really lightning fast ways. But, it might need to just be really intentional. So maybe you say something like, we're here, we're all learning. I'm going to do my best as, I'm leading the team or as I'm supervising you, and I welcome your feedback. And then you're off to the races. So it could be really, really lightning fast and I think still be powerful.
I love that. Yeah, I love that. Well, let's switch gears. I want to hear all about your podcast because I know people get many, many resources on your podcast. So tell us the name of your podcast.
Thank you. Yeah, my podcast is called Menders, Love and Leadership in Health Systems. And it's really for people interested in leadership, healthcare, and making things better. So improving well-being for the people who work in healthcare. And it's really founded, I started it based on my own experiences, really getting burned out in healthcare. But really the purpose behind it is if we can create a connection and start thinking about some of these things a little bit differently, I think we really can transform healthcare to make things better and safer for both staff and patients across the entire spectrum. So that's kind of what it's about in a nutshell.
I love it. I love your mission. I'm with you. Yes. We're like the status quo. It's not okay. We need to have safety for people that work there and for the patients, the highest level. And people are just exhausted. And again, like the literature suggests a few reasons why that might be. But I love some of the resources that you're bringing to people. Tell us about some of your specials. You're doing, like little, tell me like women, and then you're doing this. So tell me all about what's coming up. Give them little teasers.
All right.
Yeah. Right.
Well, and thanks for the opportunity to share.
Absolutely.
So I actually just released a whole season, 12 episodes that I kind of call the how-to season. And it's really digging into how do we make cultural transformation or increasing safety and employee engagement easy? How can we make this simple through very basic behavior changes? So that is just out in the last week. And then I'm also just starting to release my Women in Leadership series, which I'm really excited. So I think I've got 14 women, yourself included.
Oh my gosh. So hard.
Wow. So some pretty incredible women who actually span all kinds of disciplines related to healthcare. So I have some nurses, I have a researcher and chief well-being officer. I have someone specializing in courage. And so it's pretty remarkable, the topics that we're covering. Have a couple folks who are talking about training and thinking about how do we care for our future leaders. So it's pretty exciting lineup for sure.
That is awesome. That is awesome. And where can they find it? Just wherever they can find podcasts all over?
Yeah. Anywhere you can find podcasts. You can also go to my website, mendinghealthsystems.com. There's links there, but Apple, Spotify.
Yeah. And we'll link it here to the video too. Oh my gosh, that's so exciting. Good. So tell us about your journey building a podcast. What have been some of the surprising outcomes for you?
Yeah. So I honestly started my podcast a little bit on a whim, which I don't think is what they would recommend.
Right.
But I just kind of got the idea. I was like, I'm not quite sure what I'm going to do next. I need to funnel my creativity and my energy somewhere. And I was interested in connecting with more like-minded people in healthcare. So I started it a little less than a year ago. And what has been surprising is that it has been a really powerful opportunity for connection and community. And I just never expected that, but it's been really remarkable to connect with people who I've known for years, but never necessarily heard their perspective. And then, people who I'm just meeting who are thought leaders, who are really fascinating and who get me to think. And I think that is one of the things I've enjoyed most is, I might expect someone to say something and they never do. And I'm always like, oh, that is really interesting. So I'm really challenged and it's really fun.
I love it. I love it. Yes, I love it. So so everybody listen to the Menders. I love it's just the title is so perfect. We're used to trying to fix people up. And this is just, and it gives a lot of hope, I think. And that's the key, right? Is just to have positive emotions, to see some hope toward the situations. That it doesn't have to be the way it is today. If you're not in a good place, it doesn't have to be this way forever. It can change with some learnings and some community building, I think, and some skill building. I love to, when on our close, let's just talk to the team leads out there, because I think there's a lot of people in healthcare that feel so strongly. Like one of the patients I recently saw, she's a nurse leader and she's been a nurse leader forever. And she was just about to retire. And then 4 people on her team quit. And of course, the CEO asked her, hey, will you stay on until we replace the team? So it turns out to be like another year and a half. And she's still there because she's so devoted and she wants to make sure she leaves it in a good place. So the team leads, they have a lot on their shoulders. Like you said, you just released that huge podcast series. And what are maybe 1 or 2 or 3 things that you would suggest the team leads do beyond what we've talked about building belonging and trust in the teams? How can they care for themselves because they have such, important roles?
Yeah. Oh, I'm so glad you asked. And team leads are really my favorite people to work with. And so I always think if you are not caring for yourself and sustaining your own momentum, there's really nothing else that you can do. And so what I encourage people to do is actually go back to your values and start there. And maybe you need to just take 20 minutes to think about what are my top 2 things? Like, what is most important to me? And how are my actions lining up with my values? And if there's something I need to do differently, I need to realign with my values. And I think when you're acting in alignment with your own values, that benefits your team without you doing anything extra. And then beyond that, thinking about the basics of having really good boundaries, delegating, and being even more focused on that when you know you're extra busy and your team is burdened. And so that might come back to the values again, like what can we let go of? What's not important? And can you use your assessment and diagnostic skills to help you clarify that? Because you might have, 50 things that you'd like to focus on, but that's not going to help you or your team. So can you narrow it down to like 1 and just be okay with that and see how much that benefits you? And, ultimately it may not be your responsibility to fix your team or fix your system. And so thinking about how can I take care of myself, or do I need to take a pause or do some other things that are really just for you, even if it seems like it's going to have a detrimental impact on your system. In the long run, if you're caring for yourself, it's going to be better for your system and for your team.
I love it. I love it. Yeah. So team leads, please write those down, jot those down. We'll put them in the show notes. It's important stuff. I mean, we have to, I like to call it like priming your brain. Like if you have a big project coming up, sometimes teams jump in and they don't sleep and they don't eat and they stay up all night. Like my daughter was a computer science engineer and they would do these, like challenges overnight and they would stay up and eat junk food and, I'll be together all night. I know they're young, but it's not the best brain state, folks. We need to if you want to solve a problem, please give your brain what it needs and your body what it needs, and you'll be amazed. And then I love the thought of aligning as well, because I think when we align, we save a lot of energy, we save a lot of time, and then we get that focus. And it feels good. And people, I don't think when they feel scattered, it's likely because they are, right? But when they're aligned, it's like, yes, this makes sense. I'm willing to do this. This means something to me and my team. We're going to go for this. It's so neat, to see when people actually do take the steps that you suggested, because we see it sometimes. And I think also is to learn the skills of, emotional intelligence, or just know some kind of emotional awareness, because the emotions are always impacting the outcome of the team actions, right? And the team connections. Yeah. So thank you so much. You mentioned a book that you love. Are there any other resources beyond your podcast that we will definitely link to the show notes? Any other resources you want to share with our teams in healthcare out there?
Oh man, I honestly, for teams, I think the 2 I mentioned are really important. Okay. So the first one is Buckingham and Goodall's 9 Lies about work. And it is phenomenal. Just really will help you rethink how you approach your team, and really practical and an easy read. Yeah. And then the other one, Amy Edmondson's The Fearless Organization, which is also largely focused on healthcare and really applicable.
Nice. Thank you. Okay, we'll leave it at that. Thank you, everybody, for your attention. We'll see you next time on Brain Fresh. Thank you, Dr. DePaul, for your time.
Thank you so much.
Stay well. Keep up your good work.